Welcome to this episode of DMC Medical Matters. Today we're going to talk about stroke and the treatment of stroke with Dr. Richard Fessler, the Specialist-In-Chief of Neurosurgery here at the DMC. Dr. Fessler, thanks for joining us. Describe to us what's happening when someone's having a stroke.
Sure. So when someone's having a stroke, it's because there's suddenly a loss of blood flow to some part of the brain. And that usually manifests itself as a symptom of not being able to do something that they could previously do.
What are the signs and symptoms of a stroke?
So we ask people to remember the word fast. They're having trouble with their face, their arm, or speech. And the T stands for time. Time is of the essence.
What are the risk factors for stroke, Dr. Fessler?
Well, the common risk factors are diabetes, high blood pressure, and heart disease. These things can each of their own accord increase someone's risk, but when we begin to add them together, they actually cause an exponential increase in a person's risk of having a stroke.
Why is it so important that all of the DMC adult hospitals are primary stroke centers?
Well, what that means is that there's a DMC hospital near almost everyone. And so if you are having signs or symptoms of a stroke, get to one of our facilities. We will have an expert available to assist with your care, and we will get you where you need to be for definitive treatment of that stroke.
In addition to the common symptoms of stroke, are there any other things that people should be on the lookout for?
There are, and in fact, people hear about TIAs, and TIA stands for transient ischemic attack. And that comes on as though perhaps you begin to lose vision in an eye, as though a curtain is coming down and then it goes back up again. That's an important sign. Other things include a period of weakness in an arm or a leg that comes and goes, clumsiness. Sometimes people notice that perhaps their loved one is confused or is having trouble getting their words out or their speech isn't clear. These are all important signs of a possible stroke. Please come to one of our facilities as soon as you can.
Is there a take-home message for people watching this as it relates to stroke?
Yes. Time is important. Please don't wait. Please, the moment you have any symptom that you think may be a stroke, please go to the emergency room to be seen. All
right, thanks, Dr. Fessler. Thanks for the important information about stroke and stroke care. To contact the DMC expert, call 888-DMC-2500. And for more information about stroke and stroke treatment, visit our website at dmc.org/stroke.